Hello everyone. My name is Joyce Adhiambo. I am a Kenyan citizen. My people back home call me under 18. I was a sex worker for many years and have lived with HIV and AIDS for the last 15 years with undetectable viral load. This means I feel healthy as you, as long as I take my drugs. I am also a TB survivor and currently an active peer educator. I have also participated in long-term research studies in Nairobi. Hence, I qualify to speak about research involving sex workers using my story. In Kenya, sex work is criminalized by the law, leading to human rights abuses, stigma and discrimination, creating a perfect storm for risk-taking behaviors. Kenya also has a generalized HIV epidemic. Like many other sex worker settings, sex work for me was an accident. I was happily married at a young age, but culture and societal issues conspired against me. My life fortunes changed after my father died. As per human global norms, my husband was expected to attend the burial, but he didn't. In our culture, this is abuse of the highest level. You can imagine what I'm going through. Disrespectful to the dead and a taboo issue. We call it chira. Due to this unexpected turn of events, I became a woman, unclean and an outcast in my community. To be expected back into my family unit, I had to be cleansed to protect them from bad omen. Culturally, those who are not cleansed are said to bring bad luck and death to their family members. I therefore decided to respect the societal and family pressures and was cleansed. This involved having unprotected sex with a stranger. This is how they cleanse you amongst the Luos, my tribe. Unfortunately, my troubles did not end there, as my husband abandoned us. I therefore had a single-handed fend for my 3 children since their father had deserted them. In the rural area, there were no opportunities. I therefore moved to Nairobi City to look for work, but I did not have any certificates for trade or jobs or any skills, nor did I have any well-placed relatives or friends to help me. I therefore reluctantly was introduced into sex work by my aunt. It was the only option to fend for myself and to feed my children. In our settings, the general members of the community stigmatize sex workers, and the group lives in the fringes of the society. Sadly, men who partake sex workers' services also stigmatize, discriminate, and ostracize them. Sex workers are therefore treated as outcasts. The legal enforcement agencies, for example, the police, who should protect human rights for all, they are also in the forefront of committing the same vices. Just to make ends meet, sex workers have to entertain at least 5 clients in a day. Most pay $1 per session. Not all male clients agree to use condoms. Some even pay more to have sex without condoms. Due to poverty and multiple needs at home, most sex workers have no choice. Thus, sex workers in our settings, by default, are at a high risk due to the multiple sex partners. That is how I got infected with HIV in the year 2002. I am among the lucky few, though, even time through the interaction with HIV prevention research programs, I became a peer educator among the female sex workers. Besides, I am a community positive health and dignity prevention champion. Basically, I encourage sex workers to live positively with HIV and to avoid infecting others. Due to the high prevalence amongst prevalence of HIV amongst the sex workers, they are grouped as key populations by the researchers. Among members of the key populations in Kenya include men having sex with men and injectable drug users or injecting drug users. The HIV prevalence is at 29% for female sex workers and 34% among men having sex with men who sell sex, compared to 6% in the general population. The differences in HIV rates and the risky sexual behaviors have been of interest by many researchers since the epidemic began. In Kenya, sex workers have been involved in multiple studies for the past 35 years. Although no major ethical challenges involving sex workers have been reported from Kenya, there are a few issues that sex workers would like to be addressed. To continue improving the existing research partnership and to prevent ethics dumping, they are asking for a few changes. I am speaking in my capacity as a representative of the community and as an active research participant. Although I operate from Nairobi, I am sure the requested changes resonate well with the sex workers all over Kenya and maybe the rest of Africa and elsewhere. To improve the partnership between the sex workers community and researchers in Kenya, the following changes needed going forward. The requested changes have been aligned with the 4 values of the Global Code of Conduct that has been developed by the Trust Project. Number 1, fairness. Sex workers ask to be actively involved not only as participants, but also as research assistants. The meaningful involvement will build capacity among the peer leaders to multiple benefits among the sex workers community. Our members kindly request what we be involved community engagement processes as translators, reviewers of study materials, especially questionnaires, advisors of the ethics committees, be given opportunities to administer questionnaires, and in supporting the communities in terms of informed consent processes. The peer educators are also well placed to create demand for any approved studies, but are currently not involved. It is time to shift gears, and the community desires to be empowered to facilitate of its own studies in the near future, or to facilitate conducts of its own studies in the near future. Number 2, we want researchers working with us to tell us everything about the studies. Difficult medical terminologies can be explained or broken down to language that we can easily understand. It can be done and it is the only way to ensure that informed consent is obtained. Also, we want to know how the samples are handled, processed, and who will end up with them. And anything that we are supposed to be informed about. We want honest researchers who share information on how leftovers research samples are destroyed or used. Community participation on how the leftover samples should be destroyed is also key going forward. We'd also like to know everything good or bad about studies results to empower our members. Number 3, care. Our public health clinics are poorly stocked and staffed by the government. We also know researchers are coming from the north, and the care support systems in their countries are different. We kindly ask for friendly, accessible, and free healthcare services that go with the research studies that are undertaken by northern researchers. These services can be provided in the standalone research clinics. For those who require hospital admissions in Kenya, cards for national hospital insurance funds can be provided to the research participants to support themselves and support their families. The fund premiums are within reach and research budgets and therefore doable. We are providing samples that are moving forward research, and our request is not outrageous. Please start reviewing the budgets, and we are sure things can actually be done differently. Yes, I can see Doris very keenly. I know of somebody who became ill after participating in a HIV vaccine trial, but the burden of supporting that person was left to the family. Research studies must therefore have insurance to cover those who come to harm. This could be taken for granted in the north, but not in our setting. Number 4, respect. Sex workers might be uneducated, stigmatized, but they want to be respected. Our personal information should be kept confidential by researchers. We fear our families and children knowing the truth about us. Hence, exposing us through data security breaches is always a gross violation of human rights. Researchers should also respect our space, norms, tradition, and the way of life. When they want something from sex workers, they deal with it respectfully. We ask the same in return. To all the researchers who are in here and even out there, is that too much to ask? Asanteni sana. Thank you.
The fabulous Joyce, who confirms what I've always believed, which is that African women are going to end up ruling the world.